Welcome to the MS-Perspektive podcast, Perspective with a K as I'm German. I'm Nele von Horsten, MS patient, patient advocate and author. I'm bringing you interviews, inspiration and information about living with multiple sclerosis and show you ways how you can positively influence the disease and make the best out of your diagnosis. On ms-perspektive.com you will find the show notes, 11 free tips as a PDF and lots of other information. And now the show begins. Thanks for tuning in and welcome to episode number 141, Navigating MS in Kenya, Faith, Advocacy and Health Equity with Reverend Kipchirchir Kigen. And now enjoy the interview. Hello, Reverend Kigen. It's such a pleasure to have you on the show. And hi to Kenya.
Hi, thank you so much for this great opportunity. My name is Reverend Kigen Kipchirchir Bernard from Kenya. Right now, I'm talking from Kenya. I work in a rural place.
Fantastic. And before we actually start with the interview, it would be lovely if you could introduce yourself to the audience. So they know who is with me on the podcast today. They know your name now and they know you are from Kenya. But maybe you can say how old you are, if you have family, if you have some hobbies, what you are doing, so people get to know you a little bit better.
Okay, thank you. As I mentioned, my name is Reverend Kigen. I'm a Kenyan and I'm based in Kenya. I'm married and I have got, we are blessed with 3 children, 1 boy and I have, and then 2 cars.
Ah, nice. So you are at the intersection of public health, planetary health, gender justice, and faith-based community engagement. What inspired this unique combination in your career?
Okay, thank you so much. Let me just give a brief outline of my life. I was brought up in a rural place, a polygamous family, and I've been having a childhood problem with my headache. I've had headache for quite a long period of time, and because of the issues of access and no medication in the rural place, I had to struggle with it during my childhood. For quite a long time, it stopped even my studies. Sometimes I could drop out of school. Sometimes I could not concentrate. But I thank God I was able to maneuver until it reached a time I was able to complete my primary and secondary schools, but still battling or having a problem with migraine headache. But because I was not able to go to see the specialist and get the right medication timely and early, I had to struggle. And after some times, I started working, doing some manual work. But most of my time I used to spend in the church. And that's why I'm called Reverend Kigen. So my first profession was working in the church. That has been my role. But now, right now, I'm in a multidisciplinary field. Apart from working in the church, I came to realize the kind of pain and suffering that people with chronic diseases they were living with. I used to go to the hospital, visit them, have a chat with them, and pray with them. But I came to realize that prayer is not the only thing. There is much more than that. And my first studies was on divinity, so I could use that as a kind of a counseling. But I realized I needed to know and understand much more. What are the causes? What are the real situation? And I came to do a small course on palliative care. Despite the fact that I used to undergo a lot of pain, I could encourage, especially during that time was working as a volunteer in the hospital, working with people with cancer and HIV/AIDS. And that is the time I came across people with other NCDs, that is non-communicable diseases, including multiple sclerosis. So that is how, from there, I decided that I want to do other more studies so as to be able to reach and to understand the condition and even advise and reach the people. That's now when I engage into public health and done public policy and done some other ways to be able to bring in diverse interdisciplinary kind of training and discipline so that I can be able uh, to provide the better care, to know how to communicate, and even to engage with the policymakers and religious leaders.
Sounds good, yes. And I was just checking, so I saw that the population of Kenya is around about 58 million people. And on Atlas of MS, so Atlas of Multiple Sclerosis, it says that there have been only 200 people diagnosed with MS in whole Kenya. And there are only 5 new diagnoses per year, which is very, very low. Um, yeah, so I guess it's not easy to advocate for chronic diseases like MS when it's so seldom happening. So you've personally experienced neurological symptoms such as the severe headaches you mentioned, also memory issues and speech disturbances. How has this shaped your view of neurological diseases like multiple sclerosis?
Okay, thank you. Could be just to begin on what you gave an highlight of multiple sclerosis in Kenya. There is actually no clear statistics. And that is why we are engaging in research. Because actually, if you go to the villages, people that are suffering from multiple sclerosis. And right now, a lot of people, they are being diagnosed of such condition.
Mhm.
But currently, if you can go to one of the national hospital and one of the best private hospital, the percentage of patient is increasing. So let me say it is not actually 200, it is more than that. And that's why we are calling for people to engage in more advocacy and research so that people they can come for examination diagnosis. So it is really more. So the kind of statistics that are available right now, let me say it is not really exact as that, because if you go to the real situation in the ground, it is much more.
Yeah, I can totally understand that. Yeah. It would be very strange if it would be only 200 people out of 58 million.
Yeah. And then now concerning the issue that I've told you, I've had neurological problems since my childhood. It has really been a struggle. It has not been easy, but I thank God. And also social life, meeting with people who can encourage you, who can speak to you. But later, during late hours, during late age, when when I got a better job, I was able to get some kind of insurance
Mhm.
because one of the things that is making people not to uh, which make people to have poor health seeking behavior in Africa and in Kenya is because of poverty. People they don't have money to go to the hospital. People they don't have money for medication. In fact, I better get food rather than getting medication or seeing a doctor. And that has been my life. But when I got a better job, I got an insurance. That's now when I started seeking going to hospitals. But also, it has not been very easy. In Kenya, we have got public hospitals, and then we also have the private hospitals. Um, in Kenya, we have very few neurologists, people who are specialized in neurology, and so that is one of the challenge. And then these specialists they are mainly found in the urban places. So in the rural, like where I was brought up, you'll find that these specialists they are not there. So we just buy medication in the pharmacy just to keep the pain relief. So now coming back to my situation, I went to the hospital. I went to the public hospital where I was booked. I had to wait for quite a long period of time, even to see the specialist. It can even take sometimes 6, 8, or even 1 year for you to see a specialist. Uh, but I had to wait because even going to the private hospital, I could not afford it. So finally, I was able to get to see a neurologist, and then underwent. They advised me to undergo MRI,
Mhm.
and then when it was done for the first time, it was too frightening for me. the machines, the room. I was alone. I had never experienced such a kind of situation. But the diagnosis, the doctor, he did not get a very clear diagnosis. He told me, you seem to be having either bipolar disorder or you are having something that is called MS sclerosis. I didn't know what that for the first time. And then that was one of the best national hospital. So he advised me that for such a condition, you need to go to another hospital for some further diagnostic. And he advised me to go to the best private hospital in Kenya,
Mhm.
which for me it was too expensive. I could not
Mm.
manage with the insurance that I had. So I had to raise money from friends. Finally, after like around more than 6 to 8 months, because still in that private hospital, you need to book for appointment, which will take time. You are put on the queue. But finally, I underwent the same, and it was very surprising. Still, the diagnosis, the doctors, the neurologist, they told me it is not very clear. He said it seems to be a kind of migraine headache, but people probably also need to see um, the doctors that deal with mental health. So it was really a problem. They put me in some medication. One of the medication is what we call amitriptyline, the ones that give you to relieve some pain. When I started taking that medication, it has not been easy. Sometimes I become unconscious.
Wow.
Sometimes I could lose my speech. In fact, I thank God right now I'm improving. Um, so I continued, but I thank God I got a very good employer in the government. They've been able to understand me, give me the opportunity. Finally, the doctor, when I was taking the medication and I told them it is not helping me. So they told me could be probably you need to go to a better hospital like in other countries, either in South Africa, in India, US. And you can imagine the expenses that is involved. The insurance that I had could not pay for the travel and the rest. But finally, I got the opportunity to go to India.
Mhm.
India, you know, I hope you have heard about India. It is well known for good and better medication. So I was there. Still, I had to go to the public hospital because they are a bit cheaper than the private hospital. In fact, the situation there is almost similar to us. I had to wait in the public hospital, almost the same process. Finally, they also told me I need to go to the private hospital. So when they told me now to go to the private hospital, I lost hope because I had stayed in that country. I had exhausted all the funds that I had. So I had to leave it and come back to my country. And but in India, they gave me some medication, of which it has been much better.
Okay. Wow. Yeah. Not so easy. Quite some challenges to overcome to get to a diagnosis or to get some treatments. And interesting that you have to travel from Africa to India, and that this is cheaper or easier than going to South Africa. I mean, same continent, but yeah, it's always interesting to get different perspectives. So, what motivates you to advocate specifically for people living with MS, especially in a context like Kenya, which seems to be challenging?
Yes, as a result of that, because when I saw that we have got very few specialists and neurologists, and these are mainly the people who are in the registry. We don't have like neurologists who are counselors. We don't have people at the community level. So there was a case of one of my relative who suffered from MS for some time. Also, she was misdiagnosed and she was given the wrong medication
Mhm.
because of the challenges in terms of affordability. And but finally, people they did a fundraising for her, and then I took for this special case. I could really empathize with her, the pain that she went through with her family. But I thank God the family was very supportive. So when I could imagine the situation that she underwent, it was almost similar to that of mine. And then I happened to have an opportunity to work in the hospital as a volunteer healthcare. And now I had to be very close with people who are living with this condition and also their caregivers. And when I could listen to them and their voices, I realized that there is a missing link. One is about stigmatization of MS. Another one is lack of awareness, lack of people, they do not know what this disease is. People, they could confuse it with witchcraft. That is here in Africa, that's such kind of thing. So there was a kind of complete misinformation. Even sometimes the healthcare workers, they are not even aware of this situation. Now, on my background, having been volunteer in the hospital, and also I've been a teacher and teaching some of the public and community health programs, I decided to take on the role because I could compare my situation with that of my friend, the relative that I told you I had. And I wanted to demystify and even to bring in the aspect of doing more studies and understanding about this situation. So over like the last 3 years, I've been doing a lot of research. I've been participating in conferences, especially in virtual conferences, especially to do with neurological health. I wanted to understand more about understanding about MS. And as a result, I'm realizing there is a missing gap. One of them was on research. Another one is understanding of the policy and gaps. And the greatest challenge is about access, treatment, diagnosis, and support. And that is why I'm coming in. I'm still new in this field, but for the last 3 years, I've been pushing myself to it. And I'm seeing this is now where I'm concentrating. I'm working on the population health, planetary health, environmental justice, and working with the indigenous communities. I work in a rural place where there is no hospital sometimes. Like I wish one day I could show you a picture where we are. There is no hospital in some other places. There is, we used what we call the community healthcare workers. Those are the people, we call them doctors in that place. That is why I'm engaging in quite advocacy at the grassroots level. And then also I want to engage with the policymakers because God has given me the opportunity. I work in the national government. So I'm seeing that opportunity of engaging and working with the policymakers, even at the county. We have got decentralized level of government in Kenya. So at least I could work with them, do a policy brief, do a policy analysis, help them to see how can we encourage this in a primary healthcare services. And that is why I am in this. And currently I've submitted some papers which are in the process of being reviewed. And then also, God willing, I'll be undertaking some few research on the issues of rehabilitation of MS, and then also to come up with a very clear registry and in terms of access, treatment, diagnosis here in Kenya. I'm trusting to work with the ministry and some universities here in Kenya. I'm also trusting to work with some partners, especially in the European countries because of the experience, so that at least I can integrate their system to some level in our system.
Sounds great, yes. The registry would be really great to see what are the real numbers. Even so, probably for all the people in the rural areas, it's still hard to get an idea of what MS could be and not, yeah. With also the religious issues of people thinking that there is witchcraft included where there is a real neurological condition. So many challenges. Maybe could you describe in a short way what the journey looks like for someone in Kenya who is seeking neurological care from symptoms to diagnosis and treatment? I mean, what is the reality right now, and what do you think might be possible in the next years?
Okay, the health system in Kenya is categorized like it's almost all the other systems of like starting from the primary care, that is at the level of the dispensary, going to a higher level, secondary, and then going to the tertiary level. Most of our hospitals, we call them dispensary or a health center. And in most cases, most of us, we go to the hospital when the situation has really worsened. We don't go to seek for examination just to seek whether there are some symptoms. And the reason one of them is, as told you, is poverty. People, they don't have money to go and reach access. But currently, the government, there's a kind of insurance that the government has introduced. And we are saying in one way or another, the government is trying in one way or another. But remember, resources are always limited. So, in this rural hospital, we don't have specialized healthcare professionals. You can get those very simple and basic medications like the painkillers, cough syrups, and the rest. But now, when the situation become a bit, when it progressed to another level, you are, if you are in a private, if you are in a public hospital, you are referred from one level to another. And being put on referral, it can take long. I can give, for example, somebody suffering from any neurological condition. You will be put on queue. And when you are put on queue, remember your situation is already progressing. And when you are, if you are going to be put on queue, you have to move from the rural to go to an urban place. So probably you need to look for a relative whom you are going to stay with, or you have to get some money to hire or to rent a place so that you can be going to the hospital. And going to the public hospital, you have to wake up very early in the morning, or even you spend the night, so that at least you'll be on the next line tomorrow. Because actually, people who are flocking to the national hospital, I have experience. I went there. I was there for 3 days. I went during the night so that I thought in the morning that this I'll be, but I found that the people they had already spent more time. So, especially now for somebody who is living with a neurological condition, before it reached to that level, I tell you it is not easy. Because in the rural or at the lower level of hospitals, we don't have those specialists. The specialists are only found in the best national referral hospitals, which are mostly in the urban places. For you to hear that somebody has been booked to see a neurologist, it has taken a long journey, processes. And then also the insurance that you are using, it will determine whether affordability is going to be possible. And also even the insurance that you are having, it may not be able to gather for all those expenses. So there is that, if you don't have other sources of money, like out people, they spend a lot of out of pocket expenses. So for the people who have money, they are better off. But if you are not good, if you don't have money, you would struggle. So access, let me say, it is not as easy as that. But if you are better off economically, you can go to a private hospital where the queue is not as high as in the public hospitals. And let me say, I don't blame the government. I don't blame the governance. It is because, even one, the population. Kenya population has been growing. We are now like around 50 million. If you look at the people who are flocking to this national hospital, there are so many. Like if you have the neurologists you have in Kenya, they are very few, like around that. You can imagine compared with the 50 million population. So it is not easy. So because even after going to see a specialist and neurologist, you are put on medication. When you go to that medication, sometimes it may not be available. You have to pay. You have to buy from the pharmaceutical, from the pharmacy and the chemist. Or sometimes you have to send outside. So you can see that kind of challenge. It is not easy. But I want to say there is a way that the government, there is a what we call it universal health coverage kind of scheme that the government has introduced, of which it is trying to ensure that there is that access, but also some specialized condition like neurological. It is not easy. Like, for example, it has to be approved you have to go to a lot of process. So also you see that waiting for somebody who is facing progression of disease, it is not easy waiting.
Yeah, absolutely. Because you want to have some kind of help and support, and yes, waiting then is not easy. But yeah, there are many challenges I can see, and thank you for explaining it to me and to the audience who will be listening to that episode. So, what treatment options, if any, are currently accessible to people with MS in Kenya, including medication, rehabilitation, or psychological support?
Okay, first of all, let me say, because me, I'm not a medic, mine is a public health background. The kind of medication that is available in Kenya is almost similar to what is available in other places, apart from there are various kinds of therapies that are being used. Sometimes it depends on the hospital. And remember, most of the medication, they are very common for neurologists. If you have for a neurological like MS cases. So let me say, in terms of medication, then it might be available, but it is in terms of expenses, that is one of the issues. Another aspect of whether MS people, they are getting the right, like for example, rehabilitation. It is not easy. For example, people who have got to a progression level where they need those supporting equipments like the wheelchair and the rest, it is not easy also for them because it is another expense.
Hmm.
So even getting those, because those are not provided in the hospital, you have to look for it, or you have to buy for it. If it is available in the hospital, that is another expense. But we have got some specialized personnel who are dealing with this supporting work, like the walking stick and the rest. But it is not easy. So rehabilitation also is still an issue because the people who are now at the preparation level, they need a lot of medication, which is more expensive. They need also a lot of care. And because everybody is chuckling up and down, everybody is trying to look for a job. So somebody who has progressed to a level where they need rehabilitation is not easy. It's like they are alone.
Hmm.
It could be their children, they have gone to school or they have gone to urban places. So you can see the kind of situation. Another thing is in terms of psychological support. Um, in some cases, sometimes the community, the spouse, and even the religious leaders, they could be help. But now the problem is some people, some among them, they lack this information. They are not aware of what MS is. And that's now where we are coming in. I'm working with the religious leaders, the opinion leaders, people who are trusted in the community, at least to raise awareness so that this, in terms of understanding what MS is, at least there will be that acceptability of the people who are living with this condition. They can be accepted. But in
Hmm.
some cases, I've seen when somebody is having, like a lady who has this case, you'll find they are divorced by their husband because of such situation. So you can imagine somebody being divorced, you don't have money, you don't have a place to go, you can't go back to your parents. It is not easy. So in terms of psychological support, we are still struggling because of also stigmatization and misunderstanding of this disease. And then another thing is in terms of rehabilitation, I wish we could have some a special sector in the government that are really specialized in supporting rehabilitation care in such a way that they're receiving subsidized um, products that can be used for people who are need this rehabilitative, like the wheelchair and the rest.
Hmm. Okay. But it's good that you are raising awareness everywhere. At least that is a good starting point. So you've mentioned the long waiting times and limited diagnostic tools. In your view, what are the most urgent changes needed in Kenya's healthcare system for better MS care?
Okay, one, we normally say a change begin with one person. And sometimes it may not be at a high level. And that's why I thank God even for my opportunity. We are raising awareness at the grassroots level. Raising awareness at the grassroots level will enable people to become conscious of their health. It improves their health-seeking behavior. We are now telling people, do not wait until you have become too sick, is when you go to the hospital. And also through our church, we have been organizing medical camps where we bring in sometimes the medics to go back to the rural for the medical camp so that people, they can be given some kind of an assessment and counseling. Now, that one we are working together with the healthcare workers. Even though it is not more frequent, it depends on the support and the finances that we get from just from the local community, and also with the cooperation of some of the healthcare workers. Because bringing a doctor to a village, to a place to come and raise awareness, it costs a lot. But I thank God, some of them they've been willing to come back to speak to the people, and some people they've been able to go to the hospital for examination. So we are seeing that there is that change in terms of healthcare seeking behavior, especially among the women, because MS is really affecting a lot of women here in Kenya and the young people as compared to the men. And I'm happy women right now, they are very conscious about their health. But with men, it is still a problem. Another issue is that is needed in Kenya is to reinforce the universal health coverage, so that at least the people who are in the remote or in the rural places, they can be able. Right now, the government they've introduced something what you call mobile clinic.
Mhm.
Sometimes they could go with the vehicles. Sometimes they could go even with the. They could move. They once in a while, they can take medication. They can take some of personnel. But it is not also easy and it is not more frequent. How I wish it could be more frequent, like for example, monthly basis or weekly basis. And then also we have got these international days, like for example, the international days of cervical cancer, diabetic, and the rest. So with the for MS, we are also doing that in the rural places. When we have that day, at least so that people they can also have that engagement. And also we are trying to engage the media.
Mhm.
The media personnel, they can give us an opportunity to speak even in the local radio station and television. We speak in a language where people they'll be able to, even though they start misunderstanding, we are trying to convey through the media that this is the situation. And then also, there are some people who are trusted in the local community. One of them is the religious leaders,
Mhm.
and what we call the village elders in terms of administrators. So we are using those people to make them to be champions of NCDs, especially multiple sclerosis, cancer, diabetic, and others. We are training them as community health volunteers. So at least they can go deep when we are not able to be there. So that is one way of how we are reaching. We are trying to make that access. And then another thing also, as I told you in Kenya, we have got two levels of government: the national government and the county government. Now I'm working with especially with the decentralized levels of government, whereby we are trying to encourage the policymakers at least to set apart some of the budgets, some of the money to advocate and to advocate for some of the NCDs, which is really causing a very deliberating, exacerbating a condition in the country. So we work with the policymakers. We do policy brief. We speak to them, and I'm happy in some of the places where I'm working, they've been able to set a budget for sensitization and also to provide a provision for that mobile clinic where they send their staff to go to the rural, to go and even to the pastoralist communities. So that is one of the area that is improvement. Then also at the national government, they are really trying to improve the universal health coverage. Even though it is not easy, it is too expensive. But I'm happy because to some level, the government is really trying. There is that national insurance that the government has introduced, even though it is still basic some challenges, but sincerely it has helped in some cases.
Okay. Yes, and you have to start at some point, and it's great that they are doing something, and it's great to include these religious leaders. I can see how important that is. So you are very active on LinkedIn, and that's how we got connected. And I'm very impressed how often you comment here and there and everywhere. So what role do international partnerships or global MS communities play in improving the situation for patients in low and middle income countries like Kenya?
Yeah, thank you so much. In fact, that is, let me say, the international partners, they really play a very critical role. Let me say, for me personally, I have learned a lot, even through this podcast that you have been making. I listen to them, and sincerely, it has really helped me. One, in terms of passing the information, I've been following up with the MSIF. They've really done a lot in terms of supporting some programs, especially in training. I've seen they've even given scholarship to some people living from Africa and other countries where they are able to go and do the studies so that they come and give back to the community. So I'm really very happy for what international organizations, like even what you are doing. You see, like for example, what we are talking today, when somebody is going to listen to see, they will see, go, this they are not the only one who are undergoing this. And when they hear this information, there are some lessons that we are learning from one another. Like for example, recently there was this conference. Was it in Brazil or where about the new diagnosis about diagnostic methods about McDonald.
Yeah, Actrams in Barcelona in Spain.
Yes, it has really helped me. I've learned a lot, and I'm using this information even to sharpen the people in our community. I'm using this information even to engage with our healthcare professional. So let me say the international community, they are helping in one, passing information concerning the most recent care treatment research. Another one, they are supporting also in terms of financial. Also in some cases, like for example, there are some countries that they donate medications to Africa.
Mhm.
So that is one way we have been able to see. Sometimes there is also that exchange program between healthcare workers in Kenya and other countries. Like even me, when I went to India, I learned, even though I went there for to seek medication, but I spent some time looking at the healthcare system in India. And that's why currently I'm doing those kind of research, trying to bring what is it that I've learned in the Indian system of public healthcare system. And also right now, what I'm learning from European and McDonald's, I want to see, we may not be able to implement the whole of it, but at least we can learn that we can do something. And I always believe in that benchmarking and not only benchmarking, but coming to implement what other partners they're doing. What is that? What is the best lessons that these people they have had they taken? We want to do it in our community. So we are really learning a lot from the international community. Like for example, we used not to celebrate the International Day for MS, but now it is we are now doing it as a way of relaying information.
That's great. And as I had Non from South Africa on the podcast, she said in South Africa it's not easy to reach out to the Black community because there's so much false information out there. Like you just said a while before, that people might get divorced from their partners or things like that. So they are afraid of speaking up. And in Kenya, I guess there is not so much of a white part of the population. So it is all Black community, and people need to raise awareness on their own. And that's what you are doing, Reverend Kipchirchir. So that's really great. Um, you are just mentioning that you are celebrating the World MS Day. Are there any other current awareness campaigns or advocacy efforts in Kenya that are making a difference for people living with MS or other neurological conditions?
Yes, thank you. As a result of what is happening at international level, we are now like copying what the international level they're doing. Like here in Kenya, we have got the MS Society. There is a foundation. There is a group of people who are caregivers and also supporters, and now also the survivors or people who are living with this condition. So there are those organizations. We have got like the MS organization here in Kenya. We have got the MS Foundation. And right now, I'm trying to reinforce the religious leaders because me being a policymaker and being a religious leader, I've seen the importance of these people. Almost everybody in Kenya, they belong to one religion or another. And social life is very important because in social life, where you meet with people, you interact, you convey, it's like these are people who are very close to you. So I'm seeing that missing link among the religious leaders for them to be empowered. And that is now a kind of what I'm going even from my MS Foundation. Now we are now looking at how are we engaging the religious leaders so that at least they also stop this stigmatization and see like these are demon or something. We want also them to be aware of this. So that is what is the kind of advocacy that we are seeing at the level in Kenya. And then at the higher level, we also need to engage in research. I was very happy for the McDonald and the MS. The research that they are doing, it is really of great help. Like, for example, how they were connecting the ozone air pollution with MS. And it is really happening even in some other regions of this country. Like, there's another place where those air pollution, exposure to toxics and the rest, it has really caused a havoc among the maternal health and child health. So what I really learned from there, it is also forming a basis of advocacy here. And also I learned something from your podcast that this is something that I can be able to do it here in Kenya. In fact, I've been able to engage. I was telling you, I use Zoom meeting or Google Meet so that at least we can, almost some people, they have got their phones nowadays. So at least we are able to communicate and meet. We also use the WhatsApp group. And also here in Kenya, we utilize those small informal meetings so that we can have advocacy together at this level.
Great. So from your personal journey, what helped you cope with the uncertainty and the frustration you had in getting diagnosed or trying to getting diagnosed?
Let me say, we normally say experience is the best teacher. Sometimes it is good. Okay, let me put it in words. Sometimes it is good to go undergo some of this pain and suffering so that at least you can use that to be of help to you to help other people. Like right now, some of the best advocates for MS are people who have undergone this situation and this condition. They are not afraid sometimes to go to the media to go and speak, and it is of help. It is really helping. Like when they speak even in their local language, people they are able to consume and see that this is a reality. So that is what I would wish to say. That sometimes we may go those challenges, but it is used for the purpose of upscaling some issues like advocacy or advocating for some other issues so that we can be able to help others. So our conditions or our situation, we can use like some of the foundations. Here in Kenya, we have got Cancer Foundation. You'll find that the people who started are the people who have gone through cancer or people who have gone like diabetic and other conditions. Like even for example, I was reading like the McDonald and the rest. It was because of some people of the experience of what they have gone through in their lives. So we can do everything possible so that we can be able to use this information in every sector, in every level, either in the community, either in the religious sector, either you are working whatever level of government, so that at least you can make this information. Thank you.
Sounds good. You already said it's not so easy to get like healthcare aids or get medication, but mental health is also very important. So what mental or emotional support structures are available in Kenya for people with MS? Is it mostly the religious leader, or who is responsible for that and who is helping with that?
Okay, mental health is still also an issue in Kenya. There is also that misunderstanding. Like, if it is for the religious leaders, for them, they think that mental health is a kind of witchcraft. They don't believe that there is mental health. But at least through we have what we call religious public health education, we have been sensitizing them. Now they are saying it is a medical condition. It is not a witchcraft or it is not a demon. And then another thing that we are facing in Africa, many when it comes to budgeting, we don't budget for mental health. It's like we allocate funds like any other. But now our Kenya system, they've come up with a policy, mental health policy. So that is one of the advanced issues. But now, in terms of allocation, it is still a problem, especially when it comes to the centralized level. We don't have that money for dealing with the mental health. Now, for somebody who is having MS, it is a dual crisis. It is a dual crisis. Sometimes, because you don't know which side I need to stand on this side. So, as a result of those depression, you'll find somebody who is having MS is having also mental challenges because of medication, no support, and the rest. So, in terms of we don't have a very, for now, we don't have a very clear structure or to support the mental health, especially for the people who are living with multiple sclerosis. But we are also trying to raise that awareness and also to support the people who are living with the MS, so as to reduce the incidence of being pushed towards having mental depressions.
What advice would you give to individuals with MS in Kenya who feel discouraged or overwhelmed?
I wish to tell them, one, you need to accept the situation. Some of them, they are living in denial. I can give myself. I have lived in denial for quite a long time, but especially because of what I've gone through in my neurological condition. But one thing that has really helped me is acceptance. Because once you accept, don't deny, accept the situation. And then once you accept, be ready to fight for it. Live a positive attitude, live a positive life. Use that opportunity to help yourself and also even to help others. For example, when you have a positive thinking or positive attitude, you'll be able to live long. You just adhere to the medication, take the proper nutrition, do the exercise, the physical exercise, do that which you can. I always believe that it starts with you. We normally say change has to start with you. Like, for example, my condition has improved because of I accepted and then I started fighting for it. Like, for example, I go to internet, I want to learn more about this condition. What is it that I can do? Some of things could be very basic things like nutrition and the rest. Physical exercise. Having that social network support is very important. So that's what I always to advise the people. Do not keep quiet. Just look for friends, people whom you can convey to, you can trust them, you talk with them, so that they can hold your hand and support you.
Yes, that's so important. Yes, accept this and try to live as best as possible healthy lifestyle. What do family members and caregivers need to know to better support someone living with MS in Kenya?
That's very important. Thank you for mentioning that. Our families, they are very important. They are the closest people. If there are any other people who need to understand your situation, is your family, like your husband, your wife, your relatives. Even though some of them, once they understand or they know that you have this condition, they may have a challenge. Even some of them may be running away from you, divorce, separation. But through proper counseling, sometimes it's a matter of these people, they are not aware of this condition. So if we can get supportive counselors, people who can counsel, like we have been able to counsel, we have what we call couple counseling, and they've been able to live with this condition. They understand that this is something that like any other. So our family members is very important. So communicate with your family members, let them know, understand your situation, let them support you. You can even tell them activities that you are able to do and that which you are not able to do. If you are not able to do some other activities, they'll be able to help you. Like in my situation, I was very happy for my family. I was brought up in a polygamous family, but all my brothers and sisters, most of them, sometimes I could not even do wash my clothes, but they could wash for me, even during my older days. So having a supportive family members is very important. And also communicating, convey with them, let them understand your situation and your condition so that they can support you.
Yeah. What development would you like to see in the field of MS in the next 5 years in Kenya?
Okay, thank you. That's a very good question. I will wish to see MS being integrated in the primary health care. You don't need to wait until we go to the tertiary level. We want to see MS access at the primary level. One, in terms of information. Information is very key. So if it can be integrated with other condition or other NCDs, it will be good. So let it be integrated at the primary healthcare level, and also let there be supportive system. Let the health system be supportive. Another thing is let there be enough professionals. That is the neurologists, the nurses who are dealing with the neuro issues, people who are dealing with the rehabilitative neurodevelopment, and then also let us have adequate rehabilitative devices, and then also medication. We want to see the policymakers taking up this issue so that we can lessen the burden of people. Because actually, it is becoming an issue in Kenya. It is growing. It is soaring high. The prevalence rate is becoming more. Is becoming more.
Hmm. Okay. If you could speak directly to policymakers or funders today, what would your key message be about MS and health equity?
Thank you. Health equity has been a topic of concern. Like I told you, here in Kenya, there is this what we call universal health coverage. So that is something that is emanated from the policymakers. They want to make sure that there is that access to health care to even the rural places. So I will wish to say and encourage our government to do much more. In terms of ensuring that there is that access and advocacy and more funding to the rural places, to the rural and to the decentralized level of government. And then for the international partners, I want to say thank you for the work that they are doing, even especially supporting trainings. Could it be short courses? I can give an example. Recently, I came across a course at the Menzies Institute at an Australian university called Tasmania. I did a course on understanding MS sclerosis. It was a certificate course. I was really very happy for that course. It has really helped me. So I will wish for them even to collaborate with medical colleges. I will wish the partners to collaborate with with the medical institution to offer subsidized even training because information is very key. So as for me, when I was able to even undertake that course and get a certificate in understanding MS, that was a plus for me. I really learned a lot. I did learn a lot of which right now it is helping me even in my community. It has widened my mind. So I will wish to say the international community, let them continue supporting, like for example, even training. It could be virtual, even like the advocacy meetings that we are doing. It could be those short courses. It can even for 1 or 2 hour meetings. Those short courses, it is really helping a lot. And also, let them also help training not only the medical professional, let us also look at the harlot healthcare workers like the psychologists and the rest, so that they can also be able to reach the people at the primary level, not only at the treatment or rehabilitative level. We normally say prevention is better than care. Prevention is better than treatment.
Yeah. So, Kipchirchir, where can people find out more about your work or get in touch with you who are now interested after hearing all that interesting messages coming from you in the interview?
Yes, I'm accessible. If you can Google my name, I'm a scholar and I'm also doing some other studies. Very soon, I'll be publishing some more papers on planetary health, environmental health, connecting with MS. I'm also doing issues on access, treatment, and policy making. I'm also doing issues on religious leaders. So if you can Google my name, Reverend Kigen, and also I have a link. If you just Google my name, Reverend Kigen, you'll be able to find much more. But I can also give a link, even my WhatsApp. I can also give a link to my link message. You'll be able to get me from there. And I am always available, free, without charging anything to cover any support for anybody who needs. Because me personally, I am a beneficiary of so many other people who have helped me in life. free without asking for anything. It could be information, it could be advice, it could be a link, and that is how it is. So I can be able to, if somebody can Google my name, Reverend Kigen Kipchirchir, they'll be able to find me. You can communicate to me through my WhatsApp. You can call me. You can SMS. You can WhatsApp me. You can write an email. And also, I'm available for partnership and collaboration, even when it comes to writing some journalism, and it can come to writing articles or working with indigenous level, especially if you want to know about the indigenous aspect of how people are understanding the diseases.
Sounds good. Finally, what message of hope or encouragement would you like to share with our listeners, especially those living with MS?
Me personally, like through this program, I've been able to listen to some people, brothers and sisters who are living with MS. I've seen a very good attitude. I can see that they've been able to be very courageous, because even for somebody to come and speak about the experience. So I will encourage others, the listeners. Also, be strong. Be strong, whatever level you are, whatever it has progressed to what level. Be strong, the courage that you can live, that you can walk. Like you see, mothers who have given birth to children, people, they used to think that when you have MS, you cannot give birth, you cannot rear children. So you can see. So I would wish to say, everybody who is living with MS, be strong and do not keep quiet. Talk to other people. Talk to the health professional. Share with your family. Just take it easy. It is like any other condition. It is not the end of everything. But you have that faith that you can walk in this journey, and you'll be successful. As others have succeeded, you also will be able to success. Just take care of yourself, follow the medication, get good quality food, nutrition, get that support, whatever, it could be rehabilitative, whatever, get that support, and you'll be able to live long. Communicate with others.
Fantastic. Thank you, Reverend Kigen. Thank you for being my guest. And of course, I will put your contact information in the show notes and in the blog article so people can get to you. Thank you very much. And bye-bye.
I'm also so grateful, and thank you for the good work that you are doing. May God bless you. You are of great help to many people.
Thanks. Bye.
Okay.
I hope you enjoyed the interview and learned something new. And when you are living in Europe, maybe, I think, that gives a very different perspective, hearing how it is to live with a disease like multiple sclerosis in Africa, where there is not much money in the healthcare system. But even there, it is very important to advocate for the disease, and that's what Kipchirchir is doing, and probably many other people are doing in different countries. So that's really important, and it's great that he is engaging with so many people internationally. And with that, we are at the end of this episode. Please remember, it would be lovely if you could rate the podcast wherever you are listening to it, or recommend it to somebody else who might be interested in the topics. And stay as positive and active as possible. And see you next time. Bye. Thank you for listening today. I hope you found it helpful. You may also be interested in the previously published episodes and posts, which you can find at ms-perspektive.com/podcast. Perspective with a K. You can also get a free PDF with 11 tips for your positive impact on MS at ms-perspektive.com/newsletter. If you'd like to get in touch, you can reach me at nele@ms-perspektive.com or on social media. See you next time.